Novo Nordisk is going through digital transformation, not only in how we approach patients, but in many other aspects of our everyday business. So there was also a lot of learnings from other areas of Novo Nordisk we could try to adapt to how we work with patients and how our small digital transformation would look like.
Hello and welcome to the 25 Days of Transformation series, where we talk to industry experts and global brands about the highs and lows of digital transformation. We'll learn from real-world business examples, get first-hand industry insights from the digital experts, and we'll take a deep dive into what trends to look out for in the coming months. I'm Tizzy Philp, Strategic Content Lead here at Valtech, and I'm here to guide you through these conversations and to uncover the latest and greatest in digital. Today I'm joined by Marta Nowotarska, Senior Customer Engagement Manager and former Patient Relations Manager at pharmaceutical firm Novo Nordisk. Novo Nordisk has been on a massive digital transformation, moving from a traditional digital last to a digital first organization. So today we're going to be talking through their journey and what they've learned over the course of that transformation. One of the largest changes has probably been in the shift from purely B2B to adding also a B2C approach and how they're engaging directly with patients via digital solutions. So Marta, welcome to the podcast.
Thank you very much. Nice to meet you.
You're working in a massive organization like Novo Nordisk, and you have to be part of one of the areas going through a significant digital transformation process. Can you explain a little about how you even started that journey to become digital first within patient engagement and what challenges you've overcome on the way?
Yeah, so everything actually started with the patient. So every time we are making a decision or planning a new project in Novo Nordisk, we are thinking on how to add the value to the patient. So what we quickly realized that everyday person is very digital, and it's spending most of their time on the phone or a computer, bombarded with a lot of information around every aspect of their life. So we were just trying to think about how can we add value instead of adding noise to that space. We have done a lot of research both internally, trying to figure out what was done before and what worked and what didn't, and also a lot of research externally, looking outside of the pharma industry, seeing what works with in the B2C environment, how to capture people's attention, how to make sure that the content and the substance you're offering them is truly adding value to their everyday life. What is also important for us is understanding that no matter if you're talking to the patient, to the doctor, to the payer, so no matter what your target group are, those people are first and foremost people who are using internet on an everyday basis. So we also need to upgrade our thinking in what is done on e-commerce space, for example, or what have the most successful online company have done in the way how they reach their customers, and try to follow the same steps, because our users, our customers are used to the much higher value or much higher way of working online.
This is a massive project then with lots of different internal stakeholders involved. What does it take to orchestrate so many different people and teams in a traditional pharma organization like Novo Nordisk?
You're right that it is a very big organization, and it is both a very good thing, but also a challenge. So Novo Nordisk is operating for many years in many different countries, and a lot of good things have been done. So for me and for the people who've been working with me on this journey, it was very important to understand what have already been done in the different countries and different regions, what have worked, and also what didn't work. Because I strongly believe that from the small failures or challenges we can learn the most. And then the third thing was very important to understand how to add value to both the patient and how to add value to the business. We had multiple stakeholders from different teams in Novo Nordisk, people who are working towards value towards patients on everyday basis. One of my very good friends and a partner in crime in this was actually referring to this project as building the car while driving it. And I think it's a great metaphor to showcase how complex it is, but also in the same time how exciting it is. But the bottom line is that how to build this kind of project is making a lot of conversation and a lot of research to truly understand what it is that we should be doing.
I really like that metaphor. I think a lot of people would agree with you on that. What has it meant for you to drive change from within the organization? So from changing processes, from a big bag approach to small experimentation and evaluating results in an agile manner based on the data captured in such experiments?
So for me, it was extremely exciting and extremely motivating. And I think one thing to understand is that Novo Nordisk is going through digital transformation not only in how we approach patients, but in many other aspects of our everyday business. So there was also a lot of learnings from other areas of Novo Nordisk we could try to adapt to how we work with patients and how our small digital transformation would look like. So what does it take? It takes a lot of conversations. Actually, I would say years of conversations with internal and external stakeholders, understanding on what are the motivations of each of them and what are the objectives of each of them, and trying to coordinate how to make all of this match together. One of the very important thing, and it was very clear in this project, was to find like-minded people. Because very often when you have an idea, there's probably someone in the organization who has a very similar idea and is the same way struggling to make it happen or have already started on that journey. So for me, the most key aspect of this was finding like-minded people and working together with them, meaning that this project core value was the team behind it and people who have been working together arm in arm in order to make it happen.
What have you learnt in this process? What have been the gains and the losses for you, do you think?
I've learned a lot. I have been learning every day, and I think that's why it was such an exciting and an interesting project. Every day there was either a small or a big challenge we had to overcome, and I think this is what we have learned the most from. We have learned first and foremost that attitude is everything, because in such a big and complex project, you will have frustrations, you will have challenges, you will have obstacles. So what we have really appreciated is to have a team of people behind with a right attitude and with a right mindset to push things forward, even if it takes a bit longer than expected. And talking about the team, I think right team and this feeling of partnership is also very important. So in this case, Novo Nordisk has been working with external partners. The fact that we were able to create a team across companies, work towards the same objective, and focus on what is truly matters in this, so bringing the value to the patients, to people whom we are going to serve with this solution, was the most important. And the sense of that we all believe in it and we are all going to do everything to overcome the challenges was extremely important for all of us.
Marta, I wonder whether you could give us just some more information about exactly the kind of projects that you're working on. And you mentioned at the very start about how you're working to give patients more, create more empowered patients around disease. Could you give just some more context around that for us?
Of course. So I mentioned in the beginning that we always start with research towards what patients need. So we had several conversations with our patient partners talking about how can we bring value to their everyday journey with a disease. And one thing which was keep coming back was a lack of information education around disease awareness and disease management. They said that, of course, online we have a lot of information available, and it's not the volume of the information which is a problem, but it's the quality of that information and how to navigate through what is a true information, well researched, and what is fake news or fake information. So that have actually sparked our discussions internally on how can we do that and what would be the best channel in order to bring all the content and expert voice and channel directly to the patient. So we have created something called patient engagement platforms. Those are websites which are open for everyone who is interested in that content, obviously targeting people living with a disease. And there are two websites we have focused on. It's Diabetes What's Next for people living with diabetes, and Truth About Weight for people living with obesity. And those websites are, if you take a look at them, a straightforward place where we can actually load information from experts. What is very important about this project was that actually all the information we are putting on the website is validated, and it is actually coming from people living with the disease and doctors who know about the disease. So it's our way of adding the quality to the volume already existing. And the second part of it is the user experience. So we are constantly looking into the performance of the site and trying to make sure that we can update it in order to give the user the best experience possible. So we are checking which device most users are looking at the website from. How can we make it more user-friendly when it comes to reading the content? Or maybe if someone would like to share the information with their loved ones, how can we make that easier? And in that sense, it's not groundbreaking for the world because a lot of organizations are doing that, but it was a change for Novo Nordisk because it requires following a project very closely and making very small changes on the go, which obviously in a big organization with a lot of stakeholders can be challenging from time to time.
Yeah, absolutely. And it'd be interesting to know, what was your experience working across a massive organization like Novo Nordisk in terms of aligning that unified voice towards digital patient engagement in diabetes and obesity?
It was a lovely experience, I have to say. Of course, it took a lot of time and it took a lot of presentations. So I think communication around what do you want to achieve and why it is important. It's such a crucial step in an organization as big as Novo Nordisk. Meaning, with the team behind the project, we have done a lot of roadshow, as we call, meaning booking a lot of meetings with the teams, which might either be able to contribute to the project or have interest to the project, and we have been talking with them about how we want to do it, gathering a lot of feedback on how they would do it if they would be in our shoes, and try to understand on how to bring value to their teams as well. And of course, it is also which I love the most was working directly with people who are living with those diseases. So talking with people living with diabetes and obesity. We have a concept in Novo Nordisk, as we call the disease experience expert panel. Those are people living with chronic disease who are our partners, who are sharing with us their experience, who are participating in creating this kind of solutions and services, which was extremely important in this project. And for me, myself, personally, it was a huge learning on how to approach it.
And how about what you said one of the best parts for you is working with those patients living with these diseases. How have they responded to what you've delivered at Novo Nordisk? What's been feedback?
The feedback was great, but I think it's also because we have been allowing for feedback on the go on every step of the way. The platforms, both the obesity and diabetes one, was very well received by Adboard advisory group of patients who have been working with us. But also for me, the stamp of approval is when they are willing to share their insights and their knowledge on the platform, meaning that they were willing to write content and sign it with their name on the web platform, because that actually means that it's something they can stand behind and they can put their name on. And that was happening on both of the platforms. Also, the second stamp of approval from the community is what's happening on social media. So, of course, we have run a lot of campaigns in order to make sure that people know that platforms exist. And those were extremely successful, especially when it comes to the comments which were generated. So, meaning people have actually been discussing the subjects we have been talking about on the website, on social media, asking each other questions, giving new ideas for content, sharing the content both to their own social media timelines or to their email account. So for me, that's actually means that they like it. But that doesn't mean that we should stop working on developing it and making it better all the time.
Yeah, and that's so great to hear about the community aspect. That's so important, not just for again further empowering the patients to have to be part of that community, but also for you guys to see that it's really making an impact. It's really helping people's lives. What would be your advice then for other companies thinking of embarking on a transformation of the scale that Novo Nordisk has seen? And from what you've learned, what would be your advice to them?
I think first and foremost, I think it's important to gather like-minded people. this project would not have happened if not for people behind it. And it's not just me behind it. There's a lot of great people with the same approach and the same attitude. And I think that's first challenge in such a big company, because usually those people will be in many different teams doing different jobs. And it's important that you allow those people to sit together and think about the next project, or try to help them to innovate, brainstorm, because this is where the great ideas are coming up. Second thing I would say is to talk with your end customer as much as possible. And it might be a cliche. I know now everyone is very customer centric, and that's great. But I think what brought me the most value and our team the most value is that we have allowed ourselves to speak to them in matters unrelated to the specific project, and that Novo Nordisk has such a fast track and be able to talk directly with patients around everything what's happening. That gave us ideas and inspiration to make it, to create it, because it's not that we just had a meeting with our patients talking about this is what we are going to do you like it or you don't. It actually came from many different conversations, and it was kind of built based on many different conversations across the organization. So I think like-minded people are very important. And the second thing is allowing yourself to fail, and that might be another cliche, because that's something people are mentioning a lot. But it is so true. It's so true. You need to be able to be okay with coming to your manager saying, listen, we have tried this and it didn't work. But because this is where you are gathering the most important information, and you are able to adjust the course of the project. And it could be a very small failure. It could be a bigger one. It could be that you invested in a feature which you thought it's going to be great and it was not great at all. But that also allowed us to challenge the way how we build projects in general in my area in Novo Nordisk, meaning that we could test as much as possible. Yeah, we could do A/B split testing. We could develop 3 or 4 versions of the feature and then try to see which will work in real life. So I think that was also extremely important.
I think those are some really great pieces of advice. And for us to have this conversation, we talk a lot about impacting the end user and being customer centric and consumer centric. And a lot of time that can be across retail or B2B world. But for something like a pharmaceutical company where you're directly impacting the lives of people, I think it's just incredibly rewarding to hear what you're doing and to hear that it's working out. Marta, thank you so much for joining us today. It's been great to speak to you. Really interesting, and looking forward to hearing what comes next from Novo Nordisk.
Thank you very much as well.
You've been listening to the 25 Days of Transformation series from Valtech Cafe. If you enjoyed this podcast, then why not subscribe and keep up to date with all of the episodes in this series and a whole host of insights from the Valtech Cafe back catalogue. And if you'd like more information about what we do or to get in touch, why not visit us at valtech.com to find out the details. Until next time, thanks for listening.